Thank you, Maria. Before I read the committee statement on the unequal impact of COVID-19 on LGBT plus workers, I would like to let the attendees know how they can engage with me. The question and answer function is open. So if you have any statements, observations, or points you would like to bring to the committee's attention, please make use of the question and answer function. If there is time at the end of the session, I will try and summarize the main points being made there. I will now read out the committee statement on the unequal impact of COVID-19 on LGBT plus workers. The coronavirus pandemic has shone a stark light on the deep and persistent structural inequalities which cut across this country. Working class families have been hit hardest by COVID-19, facing the greatest health risks, now on the front line of rising job losses. We are proud of today's diverse working class. We also know that within it, Black workers, women, disabled people, and LGBT plus people have all been disproportionately affected by the coronavirus crisis. We know that COVID-19 is having a devastating effect on the daily lives of everyone. However, our understanding of the particular impact on LGBT plus workers has been hampered by the very patchy information that is available. This stems from many factors, including the failure to capture LGBT plus identities within specific research and national data sets, and sometimes a lack of interest. The resulting information gaps can lead to the unhelpful assumptions that the pandemic has no impact on the LGBT plus community. We, however, know that this is untrue. The pandemic has had multiple negative impacts on the LGBT plus community and LGBT plus workers. Evidence suggests the economic downturn caused by the pandemic is impacting on the arts, culture, travel, tourism, and hospitality sectors. These are sectors where historically LGBT plus workers have been overrepresented because that has been easier to be openly LGBT plus in. And as the recession deepens, it's likely that LGBT plus workers in those sectors will be at risk of redundancy. We're also aware, given high rates of bullying, harassment, and discrimination at work, pre-pandemic, it is unfortunately likely that LGBT plus workers will be at the risk of unfairly targeted for redundancy. TUC research conducted in 2017 found that nearly 2 in 5, that's 39%, of LGBT plus workers had been harassed or discriminated against by a colleague. More than a quarter, that's 29%, by a manager, and around 1 in 7, 14%, by a client or a patient. And despite the high levels of harassment and discrimination, very few LGBT plus workers report it, meaning that the bulk goes unresolved and unaddressed by employers. And research found that only a third of respondents, that's 34%, reported the latest incidents of harassment and discrimination to their employer. With all this in mind, it's not a surprise that throughout this pandemic, LGBT plus members have told their unions and the TUC what they've witnessed, and the increase in the levels of homophobia, lesphobia, biphobia, and transphobia. This has particularly been true for the LGBT plus key workers. It is unacceptable that workers on the front line should have to experience bullying, harassment at increased levels while delivering vital services for us. The experiences which our members have brought to our attention have been borne out in the limited but high quality evidence available on the impact of the pandemic on LGBT plus people. Gallup, the LGBT plus anti-violence charity, found that during the pandemic, an escalation in the number of reports they received about hate crime and hate speech. Gallup's evidence echoed LGBT plus members' reports. It found that the violence and abuse were perpetrated by people who blamed the LGBT plus community for the pandemic. The violence, often including references to the role of the LGBT plus people in the AIDS epidemic and COVID-19 as a punishment from God. The pandemic has also physically removed LGBT plus workers from wider LGBT plus support groups, limiting their ability to seek help. For many, their own homes have been unsafe, with LGBT plus workers, often young workers, being forced to stay in hostile environments within a supportive family or in abusive relationships. And there has been a notable increase in violence and crime from neighbours, with both the LGBT Foundation and Gallup reporting an increase in the severity and hate crime committed by neighbours. An LGBT Foundation survey found that 8% of the respondents did not feel safe where they were living, and this increased to 17% for trans and non-binary people. Gallup reported that violence directed towards LGBT plus people, mainly in situations that predated the pandemic, but the situation was made worse by victims being unable to escape their homes or access the necessary specialist help and support. Calls to LGBT plus helplines have increased dramatically, with Gallup, Stonewall, and LGBT Foundation all reporting an upsurge in contacts. The government's coronavirus response has not only failed to adequately recognise and address these structural inequalities, in many cases, it's made them worse. The public sector duty means that when government is developing policy, they need to be aware of the impact that their decisions will have on different equality groups and use this information to ensure they promote equality, eliminate discrimination, and promote good relations. But too often during the pandemic, equality has been an afterthought, if not completely forgotten. With lockdowns and regional restrictions likely to continue, the effects on the LGBT plus people must be recognised and addressed. The government and devolved powers must urgently acknowledge and address the significant impact that the pandemic is having on the LGBT plus people. It must look especially at the impact on those who are key workers, and employers must take proactive measures to support and protect the health and safety of LGBT plus workers and eliminate harassment and discrimination at work. Thank you.